In an emergency situation involving an unconscious victim, a first aider should begin with a primary survey. The primary survey deals with checking the airway, breathing, and circulation of a victim. In doing so, you'll be making a proper diagnosis that will enable you to administer the correct action that should be taken. A primary survey would be as follows. First, checking for consciousness. Are you okay? Are you okay? If there is no response, the person is considered unconscious, and by law, an unconscious person is giving you permission to perform a primary survey. In doing the primary survey, you first of all want to check the airway to see if the individual is breathing. To do so, put your ear close to their mouth, looking down their torso, and in this way you can look, listen, and feel to see if the victim is breathing. If no breathing is detected, use the head tilt, chin lift method, and you're going to see if the airway is open. To do so, you will give 2 breaths. If both of those breaths go in, you have double checked and the airway is open, and then you will check circulation by the carotid artery, and you will check for 5 to 10 seconds to see if you get a pulse. This concludes the primary survey. Once you have finished this survey, you now know if the victim is conscious, excuse me, is breathing or not breathing, whether the airway is open or not, and whether the victim has circulation. In a proper diagnosis, if you find that the individual has an open airway and is breathing, or is not breathing on their own, but has a pulse, you would know that you have to do rescue breathing. If the airway is open and they're not breathing and they do not have a pulse, you will have to do CPR. If the airway is not open, we will cover the situation of a blocked airway and do the abdominal thrusts. So in that way, the primary survey that I just demonstrated will enable you, the first aider, to take proper action.